back to Medical Diaries. Thank you so much for 1,000 subscription. Yes, thank you for 1,000 subscription. I am grateful for 1,000 subscription. Thank you for sharing this video, turning on your notification, making use of the comment section, for following us. Yes, we are grateful. Please, if you need anything, send me a mail at medicaldiaries@gmail.com. Medical Diaries is MEE, the mail MEEDI. That's medicaldiaries@gmail.com. I'm just emphasizing on the double E. Thank you once again. If you need international scholarships, if you need Nigerian scholarships, Agbami scholarship, Chevron, and all of that, please, we mentor people on that. Make use of the mail and then send us the email address, and then send us a mail. And then aside that, we are going to be looking critically into the health sector. We are going to be looking at, currently, of course, we know that we are running a curriculum known as PharmD. So we are going to know the reality of being a pharmacist. If you study PharmD, like, can you prescribe drugs and all of that? Then we are going to look into the reality of being a nursing, the reality of being a medical doctor, especially here in Nigeria. So today, in today's video, we are going to be looking at the reality of being a nurse, emphasizing on, are nurses truly rude? So please enjoy this episode because it's going to be full, it's going to be nice, and it's going to be just beautiful. We would also like to hear from you. Actually, when you are done watching this video, we would like to hear from you. Yes, we would like to. So please make use of the comment section and then tell us, and I mean, we have to look into all of this because the healthcare system, I don't know, they are understaffed already. Why? Because people are actually leaving Nigeria, people are running away because of how everything is. So please, are nurses truly rude? Let's go into this discussion. You're welcome, ma.
Good morning, everybody. My name is Fumi, and I'm a nursing student.
Okay.
So I'll be talking on a question called titled "Are nurses or actually rude?" Okay, for me, it's a no question. It's a no.
Yes.
No, nurses are not rude, and I'll be talking from three perspectives actually, and I want you to see it from those perspectives. So first of all, I'll be talking about the personality. It's actually wrong of you to say nurses are rude just because you've seen maybe like 20 of them that they are rude. No, some nurses are caring. It's just based on personality, who you are,
Yes.
and it's based on how you can suppress your anger, how well you've been using your defensive mechanism when your egos are stormed and stormed and stormed. There are some people that they can easily suppress or repress their anger. They don't have a problem with that. While there are some people that they only get to project their anger at
Yes.
people. And from the perspective of the fact that the profession is female dominated, there are some people that are how will I say, females are emotionally expressive. They express their emotion. So looking from that perspective, it's all based on personality. Everybody has something that they are going through.
Yes.
Everybody has something that how well you can suppress your anger will determine how well you will relate with other people. You find out there are some, how will I say, you just hear some patient and the pharmacist was angry with them, the way they prescribed the drug to them, they didn't give them a full detail of the prescription. It's not just nurses alone. Trust me, it's not just nurses alone. Everybody has something that they are going through. Everybody is stressed.
Yes.
Everybody has a problem, whether maritally, financially. You see some people when they are financially broke, they are hungry.
Yes.
So it's not just based on the fact that
Debit alert.
exactly your money, your alert is out, like your bank is almost going red. You
Eh.
are angry. So it's not just based on the fact that we are nurses, no. Or some people say, okay, it's not like they are hungry, but it's more particular to the nurses. No, you meet some nurses and you don't want to leave the hospital again. Trust
It's
me,
true
you
actually.
will not want to leave the, you don't even want to leave the ward. In fact, if you leave, you will come back to greet them another time that I will thank you for the other day, stuff like that. So I
Yeah.
feel like this is just a personality issue and the way you're able to cope with stress. Some people can't cope with stress at all. They can't suppress or repress their anger. They are just there to just project. So
Yes.
and it is always the patient at the receiving end. So I feel like it's just based on personality. So
Yeah.
and then I'll be talking from the way the society actually view nurses. In fact, the way the Nollywood portrays nursing profession is really, really bad. Let's be realistic on that. It's really, really, really bad. You can imagine my friends, they keep telling me, I know you be a brutal nurse, you be a wicked nurse. See, these things actually grow, and we don't know that they actually grow. If you keep
Yes.
telling me that I'll be a good nurse, do you know how long a way that will go? But then you keep telling me that you be a brutal nurse, you be a wicked nurse. See, it's not meant to be. See, if you are their friends, if you are a friend with any health professional, don't say negative things about their profession. Please
Yes.
don't.
Yes.
These things actually grow. They are like seeds. You plant them without knowing. You even say them unconsciously that Oshowa Buruba, is it because you're a nurse? No, please. Let's stop doing that. Actually, that's really really bad. In
Bad.
fact,
Yeah.
if I notice that one of my friends keeps telling me that you are brutal, you are weak, I start cutting my relationship with them.
With that person, yeah.
I start cut because I won't want you to, because you are just saying it unconsciously, but it is my patient that will be at the receiving end.
Yes.
And I just get to work the second day, and I don't know, out of nothing, unconsciously I start acting the way
You
said that.
yes.
So it's actually, but then if you tell me that I'm caring, even if my patient is how will I say, he's trying to get me angry, he's trying to get me upset, I would remember what you said, that I'm a caring nurse.
Yes, actually.
I can take all of your anger, so you don't just bother. So please, it's actually, as you are being this, please, I want us to, how will I put it, say positive things about them, say good things to them, don't just
And
say any,
correct that
exactly,
mindset.
correct them. Nollywood has done a lot of things. Honestly, they've done a lot of things, but then please, I won't want us to keep going with that kind of mindset.
Yeah.
And that's the same mindset that people bring to the hospital, especially patients, because they see that nurses are rude. Anytime I'm going there to go and fight them. See,
I'll
you will
change
be
it for them. Oh.
see, you're actually at the receiving end. Let's be serious, because if you are thinking that you are rude, you are hungry, see, it's not like they will not attend to you, but they will not place you, like, everybody will be running away from you.
Yes.
Nurses too will be running away from you. They will, in fact, even other health professionals, they will be avoiding you small one way or the other. So I feel like we should actually correct that mindset. Please, whenever you are going to the hospital, believe in your mind that people you are going to go and meet there, they are nice,
Good people.
they are caring, and they will totally care for you holistically, please. And I will also be talking about the toxic working environment that nurses has found themselves these days. In fact, a lot of them work in, how will I say, toxic environment, and believe me, the hazard fee they are paying them is actually small. How will I be collecting maybe like hazard fee of let's say 5,000 naira, and then I'm working in the COVID-19 environment. It's a whole lot for me. Some people, they want to further in their courses, and there is no study leave. Although there is something called study leave, but then to get it is like a struggle. You have to struggle. So instead of going through that struggle, let me just hukuma be on this nursing duty shift. But then they keep telling you that if you don't further in your education, there is nothing like promotion for you.
Yeah.
They keep telling you, and one funny thing is that they are angry at their bosses, they're angry at those that are at the top, but then they can't project their anger.
Express it over there. Yeah.
But then they will project it to somebody that is less threatening, which is the patient. So it's not like it's their fault. So this thing is actually still based on what? Personality. There are some people that they can suppress that anger. You don't even know that their boss just finished shouting at them this morning. But then there are some people that they will express it at you. Like, why are you shouting? I'm coming, I'm on my way. I already told you I was bringing the injection for you. So why are you shouting? So it's a whole lot on the personality. And the last one, I'll be talking from the payment angle. See, honestly, the nurses are actually really, really underpaid when you compare what they are doing to the pay they are giving them. Oh no, that's really really bad. In fact, for the last 2 weeks, I was opportune to work with some nurses. At first, I thought it was just the junior nurses that were just telling me that you must travel out of Nigeria, you must not stay in this country, stuff like. I thought it was just until the ward matron also called me and she was like, you must not stay in this country, and I'm like, what? Like, I expect that somebody like you should have enough money
and enough this
exactly
thing.
You've been working in this hospital at least, if I'm not mistaken, for like 20 years. You should have enough
like
money
that.
And she keeps telling me that you have to run away out of this country, and I'm like, wow, that's really really nice, because for me it's like a good motivation for me that don't bother staying here at all.
Run away.
But then even with that, I believe in the fact that they are being underpaid. The hospital itself is at the receiving end too, because they themselves are understaffed. They are actually understaffed too, because the people that are running out of hospital, you don't expect them to get replaced immediately. Where will they pick nurses from? You don't expect them to get replaced immediately. So those that are working there, we have like two nurses to like 28 patients. What do you expect them to do? And they have a lot of patients calling them, please, I need help, I need, and you have to prioritize. You have to pick the life-threatening situation first above every other. Above every other, if life-threatening, then we have the health-threatening. So it's a whole lot. So don't feel like nurses are. It's based on personality actually. Nurses are not rude. Let's clarify that. And it is based on personality. And you and I have a whole lot of roles to play actually. Stop telling your friend that is in health profession that you are wicked, you are brutal.
Is this how you treat patients?
Exactly. Please,
Please,
stop telling them.
please,
Stop
abeg.
telling them.
These things grow actually.
The least you can do is to encourage them. Honestly, encourage them. They also
Honestly.
come through a lot of. They come across a lot of patients that are, how will I say, that are not friendly. That are not friendly at all at all.
Yeah.
And they have to, based on their profession, they still have to do something about them. They have to so please, the least you can do, please encourage them. Grow, how will I say positive things to them that will grow in their mind. And in fact, if we all, you and I have a lot of roles to play actually. That's
Yes.
it. You have a whole lot to play. If you cannot see anything good, it's best for you to shut up. I'm serious. It's best for you to not see anything about it.
Yes.
If you know that what you're going to say is negative, don't say it. Or better still, you can advise them if you see that, oh, probably the way they reacted to a patient.
Constructively.
Exactly.
Constructively.
Don't just
so that
say
it
it
will not be
anyhow, like
discouraging.
you are wicked, you are brutal, and then all of a sudden they start acting brutal. They've said I'm brutal, so therefore I should be brutal. I think that's what works on some patients. So please, let's be
realistic.
Exactly, please.
Honestly, we need to make correction to all of these. We actually need to. So please, please, I believe from today that mindset should be corrected already. Thank you so much for watching this video. Please make use of the comment section, like this video, share this video, subscribe to this channel. Thank you once again. Bye bye. I want to thank you again. Sorry for 1,000 subscribers. Bye bye.
Thank you.